Okay, you're live on YouTube.
All right, we are live on YouTube.
Okay, good morning, everyone. I'll call the meeting to order. Neighbors of Dunn County. I will call it while on the roll. Everyone is present with the exception of Sarah Kennedy, and Chairman Bartlett is also with us. Everyone should have received a copy of the minutes. What is your pleasure in that? Is there a motion to approve? Motion made by Mike Kinnear. Is there a second? Second by Chair Bartlett. Is there any discussion? In hearing none, all those in favor, show me a thumbs up or a voice vote, whatever you like to do.
Aye.
Aye.
Motion carried. We will now, there is no public comment because of the meeting is being held by teleconference. So we'll go into Administrator Flunker's report.
Thank you. So I am going to go over our normal report as we always do. There's a couple of extra things on there that might be a little bit more extensive than normal, primarily the COVID-19 part of the report. But as always, we start with Quality Assurance Steering Committee updates. This month, our primary focus for the Quality Assurance Steering Committee was on COVID-19. So a lot of the information I'll share later in my report. But we did go over our normal metrics as well. There was not anything out of the ordinary for any of our clinical outcomes, such as falls or wounds or infections. Like I said, we primarily went over COVID-19, our policies and procedures, what we're going to be doing, as well as best practices learned from other skilled nursing facilities that have had positive cases. We also did forgo doing our safety committee report since we have a new staff member that will be responsible for the safety committee, which I have a feeling Scott will address in his section of today's report. We did not have any reportable instances in the last month, so we did go over that or any grievances that were substantial. Any questions on QA? Okay. Next is the employment activity report. So I will have Chris give that part of the report.
Okay, so for the month of April, we had scheduled 8 interviews, held all 8. Number of positions offered were 6. Number of positions accepted were 5. And then number of resignations is down here. We had a full-time LPN quit, kind of reasons unknown, share some personal issues.
Okay, sorry.
Oh, can you hear me now? Okay. We had a full-time RN that had quit for personal and infection risk issues. We had 2 part-time CNAs resign, just looking for different employment. We had a part-time homemaker had resigned because she was asked to work 8 additional hours per pay period. And then we had a part-time homemaker CNA resign for a school schedule. I didn't have the position there. So if we kind of go down through the report, the numbers in red for the open positions, the RNs, they were increased by, who had left and, if we got anybody from the agency. With the agency, I can have Paula kind of speak to this. We have had a little more struggle in even getting agency people due to the COVID-19. Because they'll accept the assignment and then, a day later we'll get a notice that they have pulled their acceptance because of COVID.
Right.
That's pretty much the reason given.
And we actually do ask that question when we do interviews with our own staff that are coming here, as well as any agency staff, if they've been around anybody with COVID-19 or if they've taken care of anybody or if they've had any travel. And like Chris had said, we had people lined up and then they opt out at the last second. And so we kind of are trying to be proactive to kind of keep people on board.
Does anyone have any questions for Chris or Paula on employment? All right. I will move on then and go into the resident referral report. So as normal, Tracy's in care conferences at this time, so I will give it. We did see a little bit of a decline in referrals. This was anticipated as hospitals are not doing elective surgeries during COVID-19. So in the past couple of months, we have received significantly less referrals than usual. Fortunately, we have maintained our long-term census, so the beds that are long-term have not fluctuated as much. So we have not dipped below our budgeted census, but we have not had a strong increase of short-term rehab that we had been seeing previous to COVID-19, which is primarily due to the hospitals didn't have the census either. So we started out the month with 131 residents. We only had 35 referrals. If you recall back, for those of you who are on the committee previously, we were averaging about 80 to 100 referrals a month. So this is a huge decline. Number of residents admitted were 9 for the month. We had 26 people that weren't admitted, 12 of which went home. That's also extremely notable because a lot of people, which I don't blame them, don't want to go to a residential style setting or a facility style setting after the hospital. It's a higher risk to be in close contact with people. So if they could go home, they did go home. We were also, as well as a hospital, encouraging this. We don't necessarily want to have more and more exposure, more people exposing, as well as if someone could go home, it's a higher risk to them to come to a place like us. So for general public safety and public health, it was wiser for people to go home if they could. And then we had 3 expire at the hospital. 2 went to their first choice, one being Colfax. They had family in Colfax, and the other being swing bed. We had 1 with no insurance or out of network insurance. We had 3 with behavioral issues or legal issues. And then we had 4 that we couldn't meet their need related to their level of care. And then we had 1 that was over the weight limit. At the end of the month, we had 121 residents. We had 0 residents transferred to other facilities. We did have 4 deaths this month, and we had 15 people discharge home. We had our normal referral sources, which was Eau Claire, Menominee, and then we had Sacred Heart on there as well. Eau Claire and Menominee were the Mayo system. As I said, it was a huge decline. Typically, Mayo Menominee is our biggest referral source. They were nearly empty. They were only doing outpatient surgery during this time, so we were not getting referrals. Anyone that came to their ER was sent directly to Eau Claire. They did not take people in during this time. They were labeled what they quoted as a clean hospital. So taking people that were COVID tested negative and were doing elective surgeries that could be done outpatient, where they would not need to stay in the hospital or a skilled nursing facility. Tracy did add on here a little brief description, so I can read it as well. The local hospital discharge planners have been that hospital numbers are extremely low right now. As I am sure many of you are aware, Mayo Clinic and hospital staff are taking reduced hours due to lack of patients because of the changes local clinics and hospitals needed to make due to COVID-19 precautions. And then the rest goes on from there. It was a huge decline, as I said. We have seen it picked up since May started. We're about well, we're 21 days into May, so they have started doing more surgeries. They have also started taking in regular patients. The clinics have opened, so we have seen an uptick in referrals. As of today, we have 5 pending referrals, 3 potential admissions just for today. So it is bouncing back in that matter. And as you are all aware, 121 is our budgeted census. So we were doing very, very well above budgeted census before then, and now we're kind of leveling off at our budgeted census for 2020. Does anyone have any questions about referrals? Mike?
Thank you. A couple of questions. Now, the people that are discharged home, are they mostly from rehab?
Yes, we haven't had any long-term people decide to discharge home due to COVID-19. It was a discussion that we had primarily with our medical director about if someone could discharge home, should they, out of safety for them, but we had no residents decide to do so.
The second part of my question is, if someone comes in for rehab, can someone visit them?
No. We have no visitation per CMS guidelines unless it's an end of life situation. So on the report, we did have 5 deaths. So those 5 people were able to be visited by their family members when it was clear that they were dying. We have to take extra precautions for those visits. They have to be masked, they have to be screened, wash their hands. We have used different entrances to the building so they're not walking past other resident rooms. We've been very fortunate. It was kind of just a coincidence that most of the people who have passed away have had rooms near an exit door. So we've been able to have them actually pass no rooms at all. So they're literally just going in the building directly to the room and out. But that's the only visitation we are allowed to have at this point.
Thank you. That's all I have here.
Okay. Anyone else have any questions about the referral report? Okay, I'll move on then. The next report is the environmental and facilities report, so I will hand it over to Scott.
Thank you. As Carmen brought up, new staff member to take over for doing facilities or doing safety meetings, stuff like that. As you know, Bill Harmon retired as the facilities technician at the Neighbors. We promoted Josh Delaney, who was originally at our Judicial Center location. Josh has worked quite a bit over the years in the Neighbors, so he's quite aware of the layout and the procedures there. So we promoted him to facilities technician. So he'll be taking over for Bill and doing the safety committee, all the stuff and getting ready for all the state surveys. I think he's going to do a great job. We had one custodian that was through Express due to COVID and her situation at home with her husband working in childcare. She had to resign. We got Bob Weiss through Express. He took her place. He's a very good candidate. He's doing very well. He's been here for a couple weeks now. Doing very good, working along with Cindy Eric, other custodian that we had in previous to that. Otherwise, everything is going well, running smoothly. We have gotten things back to where we're not running the boilers on the HVAC system. Obviously, is warming up, but we also switched it so that we're over to the geofield. And I've been working with Ken from Johnson Controls into, he's the one that does the changeover as far as getting it so that the boilers are taking over more on the heat system to relieve the heat pumps during the wintertime. I'm working with him to get that so that we can perform that ourselves. He won't need to do that, that we can take over that. And so when we're ready to take over, switch things to where we need them to save costs, and we can do that ourselves instead of relying on someone else. Other than that, everything has been going pretty smooth with the facilities. We started with our getting into the grounds, going on that. Mowing operations are underway. I have two seasonal guys that are working mowing grass for the parks, and in their spare time when they're done with the parks, they will be assisting with the neighbors to keep things looking better. Objective is to get them looking better than they have in the past as far as weed control, the grass, and just an overall appearance of the facility looking a lot better. That would be everything I have. Any questions?
All right, thanks, Scott. All right, the next item on the agenda is the fiscal staff update. So I'm going to pass that over to Keith.
Thank you, Carmen. And good morning, everyone. Just wanted to give a real quick update. We've had this on the agenda the last couple months. As you know, we've had some vacancies for an extended period of time, and I'm happy to report, it's been a couple months since our last meeting, but I'm very happy to report that we are back to full staff. It's been a long journey, frankly. We had a billing position that was open for approximately 15 months that was filled in mid-February. And then the accounting manager position was open for close to 6 months. And now we have Jane Hansen has joined us from St. Croix County. Many of you have probably heard or read this already, but certainly we are excited to have her here. She started with us the beginning of April on a 3 days a week transition basis between us and St. Croix, and then began full-time April 29th. So she is close to finishing a month on the job after years of experience with St. Croix related to our operations, our type of operations, and has really been a great addition for our team. Very excited to have her on board, and we're definitely seeing really good results already. Before I turn it over to Jane to do a brief introduction, I certainly want to thank Carmen and her team, as well as the finance division team, Sarah Stabenow particularly, for stepping up to help plug the pieces as we went along. It was certainly a challenge to pick up and do things. You don't go this long with approximately close to half the positions open without impacts. And certainly you will see that in the aging reports later when we talk about that. But we made it through, and now we're excited to get caught up on things. You're receiving your first financials in a while, and certainly we're hoping to get back to normal as quickly as possible. So with that, I'd like to turn it over for a very brief introduction by Jane, if you want to introduce yourself to the committee.
Hello, can you hear me? Is that good?
Yep.
Okay. Yep, I'm Jane. I'm living in New Richmond. I worked for St. Croix County for almost 20 years, 15 in the nursing home office area, and have some human services billing experience as well. So we can use all those skills and put them to work. I'm really excited to be here at Dunn County. The staff are incredible. The fact that we're still using a little bit of Sarah's staff to help plug a few holes, and Sarah's been great, Keith's been great. We're all learning here, and we'll go forward, and I'm excited to be here and working with the board committee, excuse me.
And sorry, with that, that would be the end of my report. And if there's questions, certainly we're available for them.
All right. So next I'll move on to what'll probably be the biggest question stirring part of the agenda, as well as longest report, would be COVID-19. So last month I did send all of you a list or a description of what COVID-19 and what the neighbors have been doing, with the exception of Supervisor McCullen, Supervisor Jensen. You were not on the committee yet, so I can forward that to you as well. It's a written report from last month. But I'll go over the highlights of what all we've been doing. It's been a lot. So basically COVID-19 started at the neighbors, our efforts with it in early March, when it started to spread across the country. March 13th was the day that all visitation to all nursing homes across the country was restricted, and that has not been lifted since. So as I explained earlier, with the exception of end of life situations, we do not have any visitors at the neighbors. This has a lot of implications to our residents as well as staff. Staff is taking extra time trying to be family to the residents. They do not get to see their family. It's very heartbreaking to walk through the building at this point. They also are not allowed to be in activities or communal dining. Activities have to be at least 6 feet apart, which is very difficult, as well as not in large groups. So most of our activities are trying to do one-on-ones with residents. We do broadcast through our chapels, which we're very fortunate to have a system that was already in place that was helpful for this situation. It was previously used because we have large concerts during Christmas time or church services that not everyone can fit in one room. So we broadcast it out to the residents' rooms, but that was very helpful for this situation because we can do activities through the chapel and have it broadcasted out to the residents as well in their individual rooms. So we've tried to do things like bingo, which is very interesting through the chapel broadcasting because then our staff are running around trying to make sure they covered the right piece on their card and whatnot. We've also done music, some crafts, stuff like that. Try to do some church services situations as well as best as we can without being able to have clergy members in the building either. We also cannot have volunteers, and they would be part of the volunteer section. We also have been trying to do a lot of, as I said, one-on-ones, and we've been doing a lot of video conferencing. We have some equipment. We have also been working on a grant for more equipment. We've also had quite a bit of equipment donated to have residents do video conferencing with their family. For some of our residents, it's excellent. They understand it. It works great. But for a lot of our residents, it's more confusing than it is helpful. They don't understand that they're seeing a loved one through a screen, especially our residents in our dementia units. It's sometimes more detrimental than it is helpful, but we are getting the residents that enjoy it a chance to do it. They're scheduling it through activities. Sally and her team have been working their butts off to get as many activities as they can and keep people entertained. It's definitely hardest on the residents, so, and we all recognize that. I have kind of a list of other things that are affected by this. We typically report to you on all state surveys and when we're in windows. State and federal inspections have been postponed or stopped during COVID-19 unless there is a severe risk for infection control issues, a complaint about infection control, or a severe complaint about an abuse situation. We have not had a surveyor in the building since this started. We would have been in our East survey window at this time, but we do not anticipate them for quite some time. CMS did release kind of how surveys are going to work post COVID-19 and how they're going to catch back up. I would not anticipate a survey for a long time based on the CMS guidelines of they were going to start with who was the furthest for being overdue, as well as anyone who had a citation that was in a harm level, which was a G or higher, which none of our 3 buildings have had for quite some time, as well as anyone that had infection control issues, and we have not. So it might be some time before we see them in our buildings, which may be a relief for some, but it also means that they'll have a greater window of time to survey when they do come. As you can see, Paula, Chris, and I are all wearing masks. Our staff are all required to wear masks when in the facility at any given point, as well as encouraged to wear them outside of the facility per CDC recommendations. CMS has made the recommendation for us to wear them in the facility. That is a federal mandation that all nursing home staff, not just main staff that are taking care of the residents, anyone in the facility must be masked at all times, even if you're in your office or anything like that. We have chosen to use cloth masks at this time, which the regular surgical masks would be better. Unfortunately, we do not have an extreme supply of them, and we would prefer to save the real masks, quote unquote, for when and if we have an outbreak. They're going to be much more important when and if we have someone with COVID-19, which I probably should have started this out. We have not had any cases, but we are waiting until that would happen to use the masks that are better for infection and protecting the staff members that could then potentially spread it to other residents as well. So the cloth masks are considered to protect those around you. So they don't necessarily protect the person wearing them. They protect those around them from the person wearing them spreading it to them. The idea is to assume that anyone could be positive and be asymptomatic. So we are all wearing them, and that decision was made with the help of our medical director as well. Staff are screened upon every shift. They are screened with a thermometer, a no-touch thermometer on every single shift. Then they are asked questions about travel as well as symptoms. They have to sign off on an entry book that they don't have any symptoms and have not had commercial travel. And then they're also, if they have any respiratory symptoms at all, fever, cough, anything that could possibly be linked to COVID-19, they are removed from work and asked to go get a COVID test. We have had several staff members be tested for COVID-19 and none have come back positive at this point. On the topic of testing, we have started testing all staff and residents. That actually is going on as we speak, started this morning. We received test kits last week from the state of Wisconsin, and then we were waiting on our coolers. We have to ship them back in coolers that were provided by the state, and they are getting there. Well, they got there this morning, Paula said. So we will be testing throughout the end of this week and then next week as well to try to get as many people as we can tested. That was a state of Wisconsin initiative to get all residents and staff members of skilled nursing facilities tested for COVID-19 to get a baseline of where everybody was at. So going forward, we can try to prevent the spread from asymptomatic individuals to residents. So we are doing that at this point. It is not a mandatory program. The nursing homes do not have to participate in them. I don't really see why people would not. It is there to protect the residents. So it is our choice to do it. It is strongly encouraged, but they have said that they cannot be penalized for not doing it, but we are. It is also not mandatory for individuals to get tested. So they still do have to sign a consent form and for both residents and staff members. We've worked on several different policies to update and manage COVID-19. It's kind of been a moving target this whole time. It seems like every day something new comes out that we need to change. So we've initiated different policies regarding CPR, for example, things that are aerosol generating like BiPAP and CPAP machines, as well as where our COVID-19 unit would be if we were to have cases. So we have identified a plan if we were to have cases, but it all is kind of circumstantial. So if we had one person that was deemed positive, we would move them to where our designated COVID-19 unit is, which has been prepped and ready to be used as a COVID-19 unit with barriers and extra supplies and things like that. But if, for say, we had a whole house that had an outbreak of COVID-19, we would keep them where they are because it would be higher risk to move them and infect others. So it kind of is circumstantial on what's going on at that time. All referrals that we receive are tested for COVID-19. We wait to have a negative test before we will accept them to the facility. At this point, since we do not have any COVID-19 positive residents or staff members, we are not accepting COVID positive residents or referrals. Technically, per the CMS and CDC guidelines, we would not be able to say we are fully equipped to have a person with COVID-19. They are allowing nursing homes to have people, but it does say if you are fully equipped to do so. Technically, under the CDC's guidelines, you need a negative pressure room to do that. We do not have a negative pressure room. So if a resident that was already in our facility developed COVID-19, that could change that on accepting or not accepting, but it's not worth the risk to spread to residents that are currently in the facility without the proper measures. A negative pressure room is very uncommon in a skilled nursing facility, and they're extremely expensive to convert rooms to negative pressure rooms. Are typically only found in vent units or in a hospital setting. We have had a struggle with dining rooms. Our residents are not allowed to eat in communal dining. They have to either eat in their room or be 6 feet apart if they are a choking hazard. We do not have a big enough space in each dining room to have all the residents out and be 6 feet apart from each other. So if they can eat in their rooms, they are eating in their rooms or in a minimum in their doorways. And then staff are there to assist them. If someone is a severe choking risk, we do have them out in the dining room, but they're at a table by themselves without any other residents within 6 feet of them. This is per CMS and CDC guidelines. To help with this, we've had 18 of our management and other staff helping serve dinner. It takes a lot of extra staff time to bring dinner trays to a room instead of 5 feet from the kitchen to the table. So every day we're on a rotation. So there's 9 households, so there's 18 of us, and we do a rotation of serving dinner to the residents so that it does alleviate some of the staff time during that meal pass as well. Besides that, we're all holding strong. As Chris went over the referral report, we've had some loss in staff, but we've also had some gain in staff this month. That'll be on next month's report. But we are doing okay. It's been a common question of, is there cases here? Is there's stuff going on? We are all doing okay at this point. The first couple of months was a little bit rough because it was a lot of work for everyone, and Paula and the infection control team did an excellent job of getting that all out there. But now we're kind of holding steady and just hoping that our measures that we took worked. So does anyone have any questions on the COVID-19 subject?
Just one brief one. Is mail being allowed, like with a quarantine for a couple of days, or just straight
So
through?
yep, we are allowing mail. So that was a topic of contention when it all first started. They have said that the risk of that is very slim, as well as I talked with KT about that topic, and she said that it would be okay for us to accept mail and packages. If it is something that can be wiped down, so if a family member drops off, say, a container of something, we do wipe it down when it comes into the building, if it is possible to be wiped down. But we did confer with KT and Public Health that that was okay.
Great, thank you.
Mm-hmm. Sure, Mike.
Mr. Chair, I have a question.
Sure.
Carmen,
for it.
I'm curious. I've read about failure to thrive type for the people in the nursing home that don't get to see their loved ones. Have you seen much of that?
I don't know if we have specific cases that we could directly pinpoint to that, but we definitely have seen a decline in some residents, as well as residents saying that they're bored or sad or anything like that. It has been a topic that has been discussed through within our facilities, as well within our peer networks for our associations or the DON Council. It is a big concern. CMS did put out documentation, I guess, of how they plan on reopening nursing homes for visitation. Unfortunately, the metrics that have to be met to do so, I fear will be very hard to meet. Most of them are not metrics within a nursing home, it's within the community outside of the nursing home. So unfortunately, I think it'll be quite some time before we'll have visitors allowed. But yes, we have seen a decline in residents, and I do expect that to continue. We're doing our best to try to keep them engaged and try to keep as much as we can them happy and doing things, but it has been an issue, and it's not good for them.
One other comment, I do know that the staff has been taking emails, I believe, to the residents. Is that correct? You can email and put their name in the
Yes.
subject line and they get it. So you guys, good job.
Yes, our website actually does have a link that says email a resident. Or it can be emailed to our info line. So there's two different ways to do it. Our info line comes directly to my email. Otherwise, the email a resident goes to our activities staff, and then they disperse them out and they'll read them to the residents if they're not able to do so.
Thank you.
I have a comment.
Sure.
I was wondering if there'll ever be a chance that they could do a visit outdoors.
No, that's actually one of our biggest concerns is now that the weather is warming up that people want to do so. The virus still can spread when people are outdoors. So we can't have visits when they're outdoors either. So we've had to kind of monitor when our residents, they are allowed to go outside. So we have courtyards, we have great walking paths. The sidewalks around our buildings are excellent for residents to go for a stroll, or if a staff member can push them in their wheelchair. But unfortunately, we can't have them within contact of their family members. We have had people do window visits. When the governor's safer at home order was still in place, that was another topic of contention of should that be allowed or not. But now that that is lifted, it's kind of a moot point, but we do have families come and visit via the window. Frequently they'll call at the same time as looking through the window. So that's the closest we've got into visitation at this point. Does anyone else have questions about this? Okay, and if there ever were to be cases or any other significant update, we would update you on that as well. I know I've received a couple of emails and questions from different supervisors about if we had cases or not. If we did, we would update you because we know you would receive plenty of phone calls, just like we will in that scenario. So it is public knowledge when a nursing home has cases now. It's posted on DHS's website. It doesn't say the number of cases, nor does it say if it's a staff member or a resident. But if we had a case in any of our 3 facilities, we are mandated to report it to all of the residents, their family members, the staff members, the state of Wisconsin, the CDC, as well as it is then posted on DHS's website. So there is a listing. I would caution all that the listing does not mean that a nursing home is a bad nursing home. To be honest, a lot of them mean it's a good nursing home because it means they're doing their screenings properly. And they're testing people and they're making sure that their people are healthy. So there's a lot of nursing homes on that list already that have received a lot of negative press. And like the one that's closest to us, it was just a staff member and she has not been in the building for a month but they're still on the list. So it doesn't necessarily mean there's some mass outbreak of all the residents and what's not's going on. So it definitely doesn't indicate poor level of quality of care. In my eyes, it actually shows that they're doing what they should be doing and screening people. Any other questions?
Yeah, Carmen, will you be doing all the testing at once and sending them all at the same time?
That's a good question. So we have a courier service that will come and pick them up. The state has been extremely generous and easy to work with in this process. So they have donated or given the nursing homes all of the tests. We have 350 tests. And then as I was explaining earlier, we have coolers. There's a courier service that will come and pick the coolers up for us so we don't have to deliver them to Madison ourselves. As long as we call before noon, they will pick them up the same day. Exact Sciences is the lab that will be doing the testing or the actual running of the tests. And they prefer if we have the tests to them within 24 hours of us taking them is the goal. They do have to remain cold and they're only viable for 72 hours. So because of the influx of testing that they're getting, they want to make sure that they get them soon enough so they have enough time to do the test. So we will be doing it multiple days, getting as many as we can in a day, shipping them out that day, and then continuing to do them until we get everybody that has agreed to be tested.
Thank you.
Yep, I guess it'll probably be a week or so. We have gotten consents from the families of the residents, but catching all the staff will take a bit of time, especially because we do have staff that only work a couple days a pay period. So we will be asking people to come in probably on their days off if they can to be tested just out of, we don't want to be sending one test a day kind of thing. So try to get them all in big groups. Does anyone else have any other questions on COVID? All right. And if you ever have any questions, you can all, as you know, reach out to me at any time, email or phone call. I'd be happy to answer them at any point. All right, the next item on the agenda is Pbj reporting. This was on here from back the last time an agenda went out, I think it was March, and then we didn't have the meeting. So Pbj reporting is our reporting system for getting our staffing hours to CMS. It is how we get our 5-star rating for our staffing levels, and then that goes into our overall 5-star rating for our nursing homes. Chris is who does our reporting for that. Since we have a new payroll person with the county, she had done Pbj reporting before and had a different way of doing it. So we did attempt to do it that way this reporting period. So there was a few hiccups in it because it didn't jive with SAP as well as it did with some other systems, but we did get that reported, which was due in May. CMS did extend the deadline for Pbj this time due to COVID. We did decide to just do it on schedule as we'd have to do it anyways eventually. And we're fortunate right now to not have extra stress on our operations due to COVID. I think they put that in place for the other parts of the country that are seeing more strain from this at this point. So we did report for Pbj, and going forward, we will also have some changes that need to be made for Pbj as they are changing their reporting and basis on their side of things. So that'll be this summer that we need to update that as well. I don't know if Chris, if you had anything else to add on that.
The update of the spec was originally due June 2nd, but that's been pushed out to an unknown date because of COVID. So, I mean, but the sooner we address it, the better, obviously, so we can just keep reporting in a timely fashion. Because if we let our current spec lapse, what I would report to CMS wouldn't be relevant, or what CMS wouldn't accept it if it's not put in the format that CMS expects. So where we stand with that.
Thanks, Chris. Does anyone have any questions about the Pbj reporting? Okay. The next item has been on here for quite some time, the land lease signature. I just wanted to keep this on here since we haven't met for quite some time. This was signed. I don't have the date written down at this point, but it was signed before the last meeting that we were supposed to have that got canceled. So back in February, it is all completed and done through the land lease. So I just wanted to update you all on that since that had been on the agenda for quite some time. So that has been all completed. Both parties have signed the lease. Does anyone have any questions on that? All right. The next item is census and case mix. I kind of talked about census a little bit earlier, but I'd like to do a little bit deeper dive into it. So as I said, we have seen a dip in our census primarily due to COVID-19. This is in our short-term rehab census. Our long-term has stayed extremely stable. Both our outer two buildings have been full, and if we had someone pass away, has been filled within a day or two. So most of those are people that were in the central building in our short-term rehab that were waiting for a long-term bed to open up. So then they're moving to the outer buildings. And then some have been from the community as well. If someone has come from the community, we do also ask for them to have a negative COVID test before coming in. So even if they're not hospitalized, if they're coming from home, we do have them go in and get tested before coming to us as well. So census has dipped, but it has stayed at 121 for the average of the month. So that is our budgeted census of 88% is right at 121 for residents a day. So we have maintained that. There was a couple days that were in the high teens, so 118, 119, but our average has been 121. It's unfortunate as we were seeing our census be up in the 130s for quite some time, but we did anticipate this with the lack of surgeries or other reasons to go to the hospital. And a lot of people do want to go home, which is understandable. Does anyone have any questions about census at all? Okay. And then I guess our next item, unless anyone has anything else to discuss on that. So then our next thing would be considerations to be taken by the committee. So I'll give it back to Brian.
Okay, thank you,
Mr.
Carmen.
Chair. Mr. Chair, could
Yes, Mike.
I get a question? I have a couple of questions on the other. It went by too quick for me.
Sorry about
Absolutely.
that.
I'm just curious how the Meals on Wheels program is going now with all this. And the other question was the bus situation you talked about. Just those two things, please.
Sure. So the Meals on Wheels is continuing the same. We haven't seen much of an increase or decrease. It was steadily going up before this all happened. So it has still increased a little, I believe, but we are still doing Meals on Wheels. I do know from talking with Bobette from the ADRC that there was some issues with some of the congregate meal settings and how that was going to work, but it has not affected our side of the operation. So I do not know the specifics of how the congregate meal settings handled the whole no groups issue, but it has not affected our numbers. And then on the bus situation, it's kind of put on hold at this point as our fundraisers that we had discussed, we can't really do. We have missed some fundraising opportunities as well as some of our typical marketing opportunities we haven't been able to do. We are working on different ideas that we could do without people being here, but most of the time our fundraising opportunities are events of some sort, as well as at this point our bus has not moved for a couple of months, so it's not as pressing as an issue, I guess, at this point because we can't use it anyways. Our residents are not able to go on outings at this point. But it is something that we'll be looking further into in the future.
Thank you.
Anyone else have any other questions for me? All right, so that
Okay.
concludes my report.
Thank you, Carmen. Has everyone had a chance to look at the vouchers? Hopefully you have. And if there's any questions on the vouchers right now, now would be a good time to ask. Yes, Mike.
Well, here I go again. Sorry to keep asking questions, but I'm just curious. We've talked about advertising before, and as I go through the vouchers, I see a little bit of money spent for advertising. So could you tell me what that is, please? And I'm wondering if you're having any kind of problems getting some items. So those are two questions.
Sure. For advertising, we still do use the Blue Group for our website. So I'm not sure what item you're specifically looking at on there, but so the Blue Group does operate our website for us, as well as we have been using our website and our newsletter. So our newsletter is via our email, which is also through the website. So that has been used frequently due to the COVID situation with sending out letters and memos to our families. So that's been one of our primary ways to communicate with the families during this time frame. So the Blue Group has helped us with that, as well as we have before COVID started, we had signed up for a couple of advertising style events, marketing events. So one of those we should be seeing, we got the refund in May. So that'll come back to us because we won't be able to do that event. We were supposed to go to the National Seniors Day at UW Eau Claire. We did that event last year and it was extremely successful. We had given away our cinnamon rolls that we have at the bistro. We had made miniature versions and given them away as our instead of pens or something like most booths had, and then also given away with that a coupon to the bistro to get another one. So then they'd have to come to the building. So that actually worked really well. We had a ton of people come back in to redeem their coupons and then got to see the neighbors and everything like that. So we're a little bummed that we weren't able to do that this year, but that might be one of the charges under advertising. But for that one, we will see the deposit come back to us because we weren't able to do that.
Any other questions for Carmen? And hearing none, we'll go into the financials. We will review the financials.
Okay, we're on mute. Well, we have financials. That's the good news of the day. It's just been a really fast month here of learning the account numbers, the balances, the formatting, what numbers go where, because it's always different with each facility. So the good news is we have financials. They're as close to accurate as we could get on the macro level. And what I see, I guess I'm not as familiar with what the norms are as Carmen and the committee is, but it seems to be on track. We reviewed them in-house 2 days ago, and I think we're all on track as far as what your norms are. Is that right, Carmen?
Yes, there's a couple of things that may be affected from the COVID-19 situation. As you can see, the bistro has no income. The bistro has been closed. So that will be something that's different, as well as there has been uptick in nursing that has been the same for quite some time. That also might be a little bit higher due to purchasing of excess PPE and situations like that.
And we're also seeing a decline in the Medicare B revenue. And of course, Medicare B expense would match, that as far as being less of an expense because we're not doing therapies as much in-house, and we're not getting any people from the community in to do therapy either. So that is a little bit off due to COVID-19.
And I can explain that a little bit further, is we do still do therapy for our Med A residents that come in for therapy. We have tried to limit the movement of staff throughout the 3 buildings. So as if someone is in the outer buildings that may be receiving Med B therapy, which would be a long-term person that is getting therapy to maybe do a restorative program or gain some strength after a fall or something like that, but they weren't hospitalized to have a Med A stay. We've been trying to limit the exposure across campus from other departments. So we've been relying on restorative programs a little bit more than Med B recently.
Yep. And as we recap the end of the year, we're working on end of the year reports for the cost reporting. And what we're seeing as 2019 wraps up and going into 2020, the veterans revenue from the veteran contract is stable. It's very stable. We have a lot of residents, but they're not very quick at paying, but they do pay. But that's a change that I'm seeing, that's a good solid revenue source that we can count on. And the Medicare A seems to be doing well relatively. So that's good news as well.
And I can touch on the veterans topic a little bit for our newer members. Our VA is a payer source for skilled nursing facilities. For one facility per county is typically what it is. So each county has a veterans affiliated facility. So we do have a VA contract. So then some people with veterans insurance basically get to come to the neighbors and use their VA benefit instead of a different facility where they may not be able to use VA as a payment source. So it's kind of hit or miss if we have a high or low census for VA. We have had a very stable census for VA comparatively to previous years. So we were seeing 2, maybe 3 across campus. Now we're up to 6 or 7.
Which leads us into the receivables report that was sent out as well. And because we had a lack of staffing and some turnover, the receivables is high. It's probably higher than we've seen it in the past years. Again, a lot of that is the VA money just sitting out there. They pay when they want to. But we are following up on those claims. They're in pay status, but we just don't have the money in-house yet, and that's typical for VA. As far as the aging, we are catching up. We still have some training to do. One of the staff is still what I would call in training. We have a few of our functions with Sarah's staff yet. Some of the inclusa billing and some of the other VA billing was with Joy yet. So we're catching up on that. We're bringing more things onto the staff as they're getting trained, as Melissa and I are catching up and catching on. So I would look to see that receivables number go down every month, as we move forward.
Does anyone have any questions for Jane or I on financials?
Dave?
Sure.
I've got a couple of questions. On the receivables, there's almost 300,000 over a year. Can we anticipate collecting those is one of my questions. And the other one, I guess, when we look at all the money that's under receivables, where does that fall on our financial statement? Is it included in revenue, or is it still coming in revenue?
It's all included in revenue because we post it as as we charge it out. This, as in sales, as the moment the sale is done, the end of the month, we report all those potential revenues that we're billing for. And then if they're not, if they're not going to be collected, they would be noted in bad debt, which we'll have some of this year. That's going to happen. But we're tracking, as much as we can, appealing for timely filing claims, and collecting as much as we can, as hard as we can. I don't like to see write-offs. We're tracking the Medicaid pending people, which when they run out of their self-pay funds and they need to do a Medicaid application, we need to manage that process a little tighter, and then we won't have any gaps in payment. I see that as an opportunity going forward.
Also, a big chunk of that is the VAs, and they will pay. So it isn't all VA in that bucket of the over a year, but a big chunk of that is. For those of you who've been on the committee quite some time, last summer, some of the people or the charges that we were talking about, the VA not paying last summer, some of those still have not been paid. So they kind of pick and choose which what month to pay. I don't know if you all remember the time where they paid March but didn't pay January or whatever month it was. So it's kind of sporadic of when we get those in. They have gone through a lot of turnover at the VA and adjusting their systems. They have different people doing different things, and it's kind of been difficult to find who to contact for things. It kind of feels you call and then you get passed on to one person and passed on to another. So they're kind of figuring stuff out there too as they go through some transitions. So hopefully we will see that shortly as things settle down on both our end and their end.
Besides the VA, is the rest of it all private pay?
No, there's a mix, and I don't have that detail for you. I could get that for you for the next meeting if you would like that. That's a report that we can run pretty easily. And as time went on without Leah here, she was the main biller for VA and Medicare and the Advantage programs, which are your more tricky claims to process. So with that gap of about 6 months, I'm thinking there's a little backup on all of those. So, but Medicare A, you can bill out for a year before it's timely filing. Other insurance companies have different rules. Some are 60 days, 90 days, 180. So we're capturing, I'm going after the ones that have that shorter time limit first. And hopefully we'll be very successful in capturing as much revenue there as we can.
And Mr. Chair, if I could add just real quickly,
Sure.
that really was, I did mention this to the committee in previous months when Leah left. That was part of the transition plan that Carmen, Leah, and myself talked about is we had to prioritize billings and making sure billings were getting out because of the timely filing requirements, which in some cases with limited resources, we focused on that primarily. The follow-ups slid a bit, but we also were able to prioritize based on the fact that we knew VA and Med A were really good payers. We had a little more time and they were also a lot more stable. So we focused our energies elsewhere. Now with Jane on board with her expertise and experience, now she's able to get in and follow through on that. As far as the losses and the aging that Chairman Bartlett asked, certainly we do expect that to be going down because VA, Med A will be getting caught up on those, as well as the fact that with any claims that may initially be denied, I've asked staff and Jane has as well, we're really doubling down on if somebody denies, our staff has always been good about pushing back to really have conversation to see if we can work through that or work around it instead of just accepting it and moving on, taking the loss. And we're really trying to make appeals to people. And we've had success with that to this point.
Yep,
Thank
I
you,
agree.
Keith.
My angle on collections is that there's no reason to lose money on collecting. If we're on top of it, we've got our staffing here now. We're just about all trained, and there's appeals that you can appeal claims and have a second level of appeal, and there should always be a way to get that money. And we're not taking money out of the pockets of people. It's the pockets of insurance companies, and they know how to pay us if we put the claim in the right way. So it should work out on at least all the new billing going forward.
Thank you. Keith, would you have any idea what it was last year at this time? Over a year?
I don't have it in front of me. I know I don't have the spreadsheet open that goes back. We do this tracking spreadsheet that went out does go back. So we can provide that to the committee go forward to have more of a year over year comparison. It is high. When we did look at this initially, when Jane prepared this, and it is up. And part of it is the payer sources, and part of it is the staffing scenario. So yeah, we can get that to you. We just don't have it right handy right now.
That's fine. Thank you.
Okay.
Does anyone have any other questions on the vouchers or the financials?
I have another question.
Go ahead, Dave.
On the financials, Medicaid is up over budget. Is that up over budget because of the legislature paying us a little bit more in Medicaid? They started that last year, or is that over budget because we have more Medicaid residents?
It could be a combination of both. I would say it's more likely that it is because of having more Medicaid residents. So as people live at the neighbors for a long time, they spend down all of their money and then transition into Medicaid. So we haven't seen an uptick necessarily in Medicaid admissions, more that we have people who have transitioned from private pay to Medicaid. It's probably a combination of both. I do not believe our increase would have affected it that much. So it definitely is, some of it is that we have more money coming from the state per resident that's there due to the increase. But a significant amount of it is if you look where private pay is, that private pay is down. So private pay going down and Medicaid going up would allude to me that there's quite a bit few people who have transitioned from private pay to Medicaid.
Yep, I agree.
Are there any other questions?
Just a comment, that chart, that chart that we got that used to show us how many residents we had with Medicaid, Medicare, that might be helpful in a question like this. So I don't know if we could start getting that again, that'd be great. Thank you.
Yeah, the goal is to have all of the financial reports that we had previously. We wanted to get just the basic one as our first one coming out, but Jane and I and Keith had talked about this on Tuesday of the other reports that we had, like the census chart, the pool staff or agency staff spending, as well as the breakdown of the bistro and senior meals outside of the rest of the operations. We will work to getting all of those out there. But Jane worked really hard on getting our income statement done, as it was definitely a mess beforehand. So we thank her and Keith and Sarah for working really hard on that. But going forward, we will have all of the financials.
Yep.
And this is a good opportunity to, if I can add one more comment too, is certainly we want to reaffirm the information that's being provided. We've got a new group here involved, and if the reports we're providing suffice, we'll stick with that, and it's sounding like it does. But certainly if there's other things that you look, not that we want to drown you with information, but certainly if there's other things that you'd like us to report on, we will certainly work together to pull that together. So please keep that in mind going forward. Again, we're not looking for work or looking to drown anybody, but we're also open to other approaches. That's one of the things that I'm emphasizing with the new team members and our team in general, is we just don't want to continue doing what we're doing just because. So.
Okay, thank you, Jane and Keith and Carmen. Is there any other questions on the financials or vouchers? In hearing none, is there a motion to approve? Dave made the motion. Mike, Supervisor Kinnear, second. All those in favor say aye.
Aye.
Opposed? Carried. Is there anything else before we set up the next meeting? Yes, Keith.
So yeah, we did have one additional thing. I can speak
Oh, I'm
to it
sorry,
too. No,
Carmen.
that's
Nope,
okay.
go ahead.
We were just going to do it as an announcement. Typically we announce the next meeting at the end, so which is June 18th. The addition to that announcement is that will be the meeting that we go over our from the auditors for the financial audit. So we will have hopefully someone from Clifton, Larson and Allen here or via Zoom. However, we will be doing meetings at that point here to do the audit report for us. And on that note, if we are going back to regular meetings for Dunn County meetings, I do not know when that will transition. We will be having them over at the Government Center or the CSB building, not at the neighbors. That will be on the agendas when they go out, when that decision is made for the whole county. But we will not be able to have people at the neighbors. So we would be meeting at the CSB in the boardroom instead of at the neighbors where we normally meet.
Okay. Does anyone have any other questions at all? In hearing none, meeting is adjourned. Thank you. Welcome to everyone new.
Thank you, everyone.